My guest is Dr. Ali Golshan, LSI 2023. Ali, thanks for coming by the studio.
Ben, thanks so much for inviting me. I feel honored. I feel like the invitation was intended for somebody else and got lost in the mail, but I appreciate the vote of confidence.
So you've already been traveling. So you just came in from the White House. What were you doing back there?
I was in the White House attending a Iranian New Year celebration where the president and the first lady were kind enough to continue a tradition that the Obamas started, which was to celebrate the Iranian New Year's in the White House. And I'd have to say that the president and the first lady were very gracious. They went through the trouble of learning some tidbits about Iranian history and poetry and really made it feel like the White House was the people's house and that it was an inclusive event. So it was pretty amazing.
That's terrific, Ali. Thanks for sharing that with us. We're going to be talking a little bit about a company we're working on together right now. Tell us more about Controlled Delivery Solutions.
Yeah, so Controlled Delivery Systems, Inc. is a company that's really born out of my day-to-day practice. So I treat peripheral vessels, arteries and veins. So if you have a clogged artery in your leg and you're at risk of amputation, we unclog it. If you have a leaky vein in your leg, which is basically called varicose veins or venous insufficiency, and that's where the blood goes down the vein instead of up towards the heart, pressure builds up, and it's often misconceived that that's a varicose vein that's just cosmetic, but in fact venous insufficiency can cause leg swelling, pain, discoloration, number one cause of non-healing wounds in the legs, and can also lead to infections and bleeding vessels. And so I do a lot of venous insufficiency or varicose vein therapy, some medical, some cosmetic. And in the course of the practice of my venous practice, essentially using the different tools that are available and transitioning from the first generation to the second generation, I found some pain points. And I would get calls from other physicians with the same concerns, asking for how to optimize their venous therapy. And I was like, gosh, wouldn't it be really amazing to be able to optimize this treatment? And it kind of started with that ridiculous, you've met me before, napkin sketch or top of a cardboard box.
DHL box in your case.
DHL box, baby. It's all about the DHL box. But really it was a napkin sketch and then, kind of thinking through the idea and then just, realizing how much work it is to go from a napkin sketch to an actual product and going through that journey.
But you not the first time that you looked at going from ideas to actually making products. Wasn't your dad had something in the basement, was always sort of tinkering? Didn't you grow up around going from napkin ideas to actual products?
Yeah, so my dad was an electrical engineer. He had a PhD in electrical engineering and he worked at Jet Propulsion Lab, which is part of Caltech but affiliated with NASA. So he did a lot of deep space stuff and low Earth orbit stuff. And so he was always a tinker. He was one of the creators of satellite radio, and one of his master's theses was the display system for the digital system, like an LED watch. So he's definitely a creative guy. And I remember that when the Iranian Revolution happened, he left his job where he was trying to help the government create a satellite telecommunications network in the 70s to creating a laboratory in the basement. And he was building small machines essentially to automate, production of different things. And I'd go down and I'd put my overalls on, get my wrench, and obviously screw everything up. But I was learning how to be mechanical and how to create. And that was at the age of 5 and 6. And so fast forward, he suffered from a ruptured intracranial aneurysm. And his physician was a guy named Fernando Vinuela at UCLA. And he ended up being my mentor. And he was part of the laboratory where the original Guglielmi detachable coil was created, the Mercy retrieval device, which was the first thrombectomy device for stroke, and Onyx, and the Matrix coil, which is a bioactive coil. So he was really a prolific inventor. And I think that, getting exposed to that kind of planted the seed that was pre-planted or watered the seed that was planted. And then I was like, okay, let me go get an MBA. Let me learn about the business side of things. And then I was part of an early stage AI startup in 2006 when I was doing my combined MD MBA program. So really the seed started early and I was fortunate to have good mentors and it was watered continually.
So was it part of what happened to your dad is what led you to go, because there's lots of different ways to be a surgeon. Is that what led you to look at the vasculature and how to help people?
Yeah, definitely what happened to my father was probably the catalyst for going into interventional radiology. And I think that at first it was going to be neurointerventional radiology, and then I just decided to make the transition to interventional instead of neuro, just because I thought to myself, there's so much territory and so much pathology in IR rather than neuro IR, although neuro is amazing as well.
Well, isn't the break kind of like from the head up or the head down? And you kind of did a calculation and said, wow, seems like maybe a lot more vasculature south of the head?
A lot more real estate, and also I think, the ability to innovate, because there are just so many brilliant people working in all spaces. But sometimes I remember I was getting my MBA, and there was one of the board of directors of the business school sitting, and he's like, "Ali, what do you think I do?" I'm like, "I don't know." He's like, "I've got a PhD from MIT in engineering." I'm like, "Okay." He's like, "I work in plumbing supply distribution." He would buy up middle market plumbing supply stores that plumbers would go to buy their plumbing supply stores from, and he integrated RFID tags, ordering systems, inventory, etc. He's like, if you're one of 1,000 brilliant people in a room versus the one person that brings a new technology to the space, you're going to have more of a delta or more of an impact. And not to say that, there are only smart people in neuro or IR, but it's just that there's such a breadth of potential pathologies in IR that are underserved that if you take a couple of intelligent people and focus on that unmet need, you're going to have more incremental delta than being the, X additional person focusing on a really small amount of real estate.
But do you see yourself as a plumber?
I really do. I actually, when people ask me what I do, I just say I'm a human plumber. And it's because there's so much confusion about interventional radiology. You're like, well, I'm a radiologist. They're like, oh, you read films. I'm like, no, I do procedures. And they're like, oh, so you're a vascular surgeon. And I'm like, not exactly. So I just gave up and I just say I'm a human plumber. It's easier. Everybody gets the plumbing. And it's intellectually a very simple field because you're unclogging things that are clogged and you're clogging things that are leaky. But the nuances can get detailed. But I think, just to come over that fear and kind of, patients are already scared of doctors. And they're already kind of elevated in this position of authority and they're scared, et cetera, et cetera. So I think it's okay to kind of simple it down and make a joke. It's totally fine.
Well, let's get into what it is about your technology that's going to change, because I think that you've got a really practical sense. Been practicing for a long time before you started to say, I think I'm going to change the way that my day-to-day practice is going to unfold. So let's get into some of those pain points. So what are a couple of the pain points that you feel like you're really addressing with your new device?
Yeah. So essentially, the thing to remember, as one of my mentors said, is if you give a physician an opportunity to misuse a device or complicate a procedure, they will. And so the thing you have to remember is that most physicians perform a plethora of procedures with a large number of devices. And there's just so much variability, right? And to expect that physician to know every single nuance of that device and what its optimal use is and have memorized the IFU is ridiculous, right? Because the engineer, the person who's created that device, spent years making it, creating it, optimizing it. So really, you want to make that thing as easy to use as possible. You want to make it super simple. And if at all possible, you want to make it of components that are already familiar to the physician. They don't have a learning curve, because the doctor's not going to try something 3 or 4 or 10 or 20 times until they optimize it, right? They're going to give it a chance or two, and if it doesn't work, they're going to move on. So simplifying the process is number one. And number two is making it so that it actually addresses the workflow of the physician and the patient. So does it solve the issues that come up post-procedurally with pain? Does it address the complications that occurred during the procedure? Is the setup and the prep and the post-op easy? So just kind of like imagining that you're a little, bionic fly, because you don't want a real fly in an OR because that's not sterile, and it's following you through the procedure and it's observing every little thing and it's making notes about how to optimize that process, which when you've done something 10,000 times, you know the process, right? And so that was really the goal. And so I think that, for venous therapy, treating incompetent veins in the legs, treating varicose veins or pelvic veins, that has to do with how long it takes to set up the procedure, the amount of other stuff that you need to do the procedure, extra tubes and fluids, et cetera. How quick and simple is the actual procedure in terms of time for the physician and discomfort for the patient and the physician. And then post-procedural stuff like holding pressure, wrapping the leg, and just kind of optimizing that process. So really, when you think about it, I think people think of veins as a straight tube that holds blood. And so, the son of engineer geek in me, capacitors store charge, and veins store blood. Veins are the capacitors of blood in your body. And so the right way to look at them is a squiggly tube with a bunch of branches. And if you can isolate that system and treat it holistically, but separate that bad disease system from the good healthy system, then you've optimized your goal, right? And so that's what controlled delivery systems is about. It's about getting a simple tube into that bad vein, isolating that bad vein from the good vein, and getting a therapy which can occupy that system of bad veins, but separate that therapy from the system of good veins. And when you boil it all down, our initial prototype, it looked freaking terrible. I remember busting this thing out, and I'm about to have dinner at my mom's house, and I'm looking at it, and I'm just like, this is horrible. I don't even know how to use it, and I made it. and then just like, ah, I don't want to think about it. And then iterating over and over again to the point where it just looks like a tube with a balloon and some wires on it, which is beautiful. That's what we wanted, right? It accomplishes the goal. It's simple, but to get to that simplicity took a lot of hard work and elegance. So, I think the final result I'm really happy with. We'll see where it goes. As a wise engineer once said, one of the original guys that worked on veins, the key to a good vein procedure is making sure there's no blood in the vein. And so when the balloon goes up and you isolate the bad vein, you can essentially isolate the vein, get all of the blood out, and then get your medication in. The other thing is that when you inject the medication without a balloon to control where it goes all over the place. And you have to follow it with ultrasound, hold pressure above and below. This allows you to isolate that vein and inject the medication and really not have to worry about where the medication goes because it's controlling where it goes. So it gets rid of the blood and it makes sure that the medication gets to the right place and doesn't go to the wrong place. So that's really how it changes the flow. You lay down, you put it in the catheter, you treat the vein with the mechanical component, you inject your medication, you deflate the balloon, you wrap up the leg. Very simple, few steps, takes away the pain points. It's easier to treat a small vein than a big vein. So the whole point of elevating the leg or using tumescent and a lot of these other procedures is to get that vein to shrink down around the catheter. And so with the balloon inflated with the irritation elements, it really does injure the vein wall, but it also gets it to constrict down. And so now you're making a big vein into a small vein, making it much easier to effectively treat. Less medication, less potential blood stuck in the vein afterwards to cause pain or inflammation.